Nearly 2 years ago, Dan DeBoer was having some unusual symptoms. What he didn't think is that it would lead to a cancer diagnosis.
What actually initially brought me to this whole process is I was at work, and I started to go to the bathroom several times a day, like maybe 17 times a day, which is a lot.
Dan was diagnosed in a bit of a unique way with rectal cancer. He actually had seen his doctor and was found to have an elevated PSA, which is a blood test that can tip us off if there's a prostate cancer going on. And so that doctor ordered an MRI of the prostate, and because the prostate sits right next to the rectum, they could see that the rectal wall looked very thick. And so then that prompted a colonoscopy, and he was indeed found to have a rectal cancer.
Dan was told he had both prostate and rectal cancer. He then came to Sioux Falls for treatment.
We came up here, and that's when we met Heidi and her team. Very impressive. That kind of started the whole journey, and she told me that they're going to take good care of me, and and they have.
So focusing on the pelvis, we could see that this tumor was advancing through the muscle layer of the rectum, and it was into some lymph nodes nearby. That's pretty common that we see that, but that also means that he's at risk if we're not aggressive enough up front with our treatment, that he could have a recurrence in that pelvis.
The treatment included chemotherapy, radiation, and surgery.
My predominant role in rectal cancer treatment is removing the cancer. And so that often entails what's called a low anterior resection. I perform a lot of these surgeries minimally invasively. His surgery went very well. It was actually one of the first times we've done a combined rectal cancer case and prostate cancer case, and he recovered very well.
Dan's rectal cancer and prostate cancer were removed successfully.
Now what he's doing is he's healing and recovering, and he's just in follow-up mode. We'll follow him for about 5 years.
Cancer care like this is being recognized at a national level. The Avera Cancer Institute was awarded a 3-year accreditation by the National Accreditation Program for Rectal Cancer.
That means that we have protocols for making sure the diagnosis is accurate. We have timely and efficient delivery of the treatment and a big care team that takes care of that patient. And we're monitoring our quality to, again, make sure that we get the outcomes that we want for the patients.
I think what this brings to the local care is an increased level of rectal cancer care for patients, that they can expect and have the best of care.
Keeping care front of mind for patients like Dan.
I never seen so many people in one place care so much.